All right, well, let's get started on time. Good morning and Happy New Year. Happy holidays to everyone. I want to thank you for joining us for our first Monday of the year at the NAWHC Roundtable. Today's topic is use of virtual services by on-site and near-site health centers. Uh, the way we run our roundtables is I'm going to go around the table and ask everybody who's listed, just give us your name, your organization, title, and brief responsibilities. We're going to then I'll cover the topic of the day of virtual services in about 20 minutes or so. At that time, I'm again going to go around the roundtable, ask everyone to share any experiences, advice, information, recommendations, or questions you have either for myself or for anybody else on the call. This roundtable will be recorded, and the link and slides will be available to those who participate and all now members that we have. So at this time, what I'm going to do is go around the table, as I said. Just give me your again name, organization, title, and a little bit about your involvement with Worksite Center. So Emily Burrell, Emily, would you introduce yourself, please?
Sure. I'm Emily Biro. I'm a nurse and I manage an on-site health center in Maine. I work for Intermed.
Great, thank you very much. Beth McCarver, Beth, take yourself off mute. Okay, Jason Hopkins. Jason, would you introduce yourself, please? Jason, okay, don't be shy. John Mark Fortis. John, would you introduce yourself, please?
Hi, the last name is Phones. It's like Jones, but with
Oh,
an F. And I
sorry.
work with a couple people. No worries. I work with a couple people here that are on the call, Julia Tabor and Beth McGyver. And we are with Med Center Health. I'm Senior Vice President. We're a health system, integrated health system in South Central Kentucky, hour north of Nashville. We provide on-site providers for different employer groups. We also have a near site clinic program where we work with employers.
Great, thank you very much. Tony Mussey. Tony, introduce yourself, please.
Hi, Tony Musi. I'm a physician, clinical vice president with Care ATC. I've been in the on-site care game for 9 years.
Great, thank you. Uh, Joseph Brillantino, please. Joseph, introduce yourself.
Hey Larry, how you doing? Joe Brillantino. I'm the lead exercise physiologist and assistant director of operations for 360 Medical out of Manhattan.
Great, thank you. Julie Tavo. Julie, introduce yourself, please.
Hello, my name's Julia Tabor. I'm an RN with Med Center Health Work Life. I do occupational health nursing on site at Industries.
Thank you. Kate Friedman. Kate, introduce yourself if you would.
Hi,
Okay,
sorry. Hi, everyone. I'm
go
Kate
ahead.
Friedman, and I have a cold, so I'm gonna just stay back on mute. But I work at I'm sorry, Millman Pluritum Health.
Thank you. Lisa Day. Lisa, would you introduce yourself, please?
Sure. My name is Lisa Day. I work for Kimball International, and I'm a health and wellness program manager managing our near site health centers for our employees.
Thank you. Neil Baconis. Neil, would you introduce yourself, please? Yourself off mute, Neil. Okay. Nick Sire. Nick, would you introduce yourself?
Yes, my name is Nick Sear. I'm one of the nurses that works with Intermed up in Maine. We contract directly with LL Bean to do an occupational health clinic for them.
Thank you. Steve Skoraki. Steve, introduce yourself, please.
Hi, everyone. I'm Steve Scrocky. I'm the Chief Financial Officer at North Penn School District, a suburb of Philadelphia. We operate an on-site healthcare center or we have been, I should say, for about the past 2 years. We have a contract with Marathon Health. Thank you.
Thank you. Sonal Tabi. Sonal, introduce yourself, please. Take yourself off mute, Sonal. Okay. Tim Newman. Tim, would you introduce yourself, please?
Tim Newman, physician. I currently work mostly in occupational space with a large utility company, but an avid follower and part of the NAWOC and Medical Advisory Committee.
Thank you. And Tracy O'Neill, would you introduce yourself, please, Tracy?
Yeah, my name is Tracy O'Neill. I'm a medical director physician for Theta Care at Work in Appleton, Wisconsin. I oversee multiple sites, including on-site, near-site clinics for different local employers.
Great, thank you. And so now, you want to introduce yourself, please?
Yes, hi, this is Sonal Tambe, co-founder and CEO of Nimble Heart. We are based in Sunnyvale, California, and we offer cardiac monitors that can be used for virtual cardiac monitoring, virtual rehab, and also we offer cardiac screening services on site.
Thank you. And lastly, Melanie Small. Melanie, introduce yourself, please.
Okay, sorry about that. Hello, everybody. I'm Melanie Small. I am the Director of Workplace Health Services located in Southern Maine. We're primarily a primary care company, and we have on-site clinics at a couple of large local employers.
Great, thank you. If anybody I missed, please introduce yourself before we get started.
Hey, Larry, Jason Hopkins here. Sorry, I was having some technical difficulties earlier. Business Development Director, Provider Relations with Vitruvian Health Care System in Northwest Georgia, Dalton, Georgia. We're a large 2-hospital system serving Southeast Tennessee and Northwest Georgia, and really looking to expand further into the employer health strategy space, and looking forward to this presentation.
Great. Well, thank you all again for participating. As I said, this will be recorded, and a copy of the slides will be sent to everyone as well, so you don't have to worry about making copious notes here. So just to let you know, we have these first Monday roundtables the first Monday of every month throughout the year. We also have webinars and programs. So in a couple of weeks, January 16th, we're joining with the World Conference Forum and running the 2025 On-Site Employee Health and Wellness Clinic Summit in Las Vegas. That's an in-person 2-day event. Our webinar for this month is on January 23rd on substance abuse and use of naltrexone at the Worksite. And our 13th annual forum, our own annual conference, is going to be April 15th and 16th in Dallas. We hope you all can participate in that. So again, I'm Executive Director of NAWHC. What I'm going to present to you today is the results of a survey we did of our employer, purchaser, and vendor members on how and what they're doing regarding virtual services. And then we'll open it up, as I said, go around the table for discussion, questions, and other ideas and information. So the survey was done earlier this year to determine the perspectives and use and the value of virtual healthcare offered by on-site and near-site centers. There were 49 responses to our survey from employers and third-party vendors, health providers, and others. And while that typically is considered a small number, what we find is our results typically are directional rather than statistically credible. But in this case, when you look at not just the employers who responded, but the number of centers offered by providers and the vendors who participated, we covered over 769 centers who offered benefits to 30 million covered lives. So I think it gives you a pretty good idea of the directions here. So again, you don't have to determine this as a hard research. This is just a Survey Monkey online survey of a few questions, but I think it'll give you, again, a good idea, a snapshot of what's going on in the field. So we asked people for their responses. You can see over half of the responders were from employers, public and private employers, large and small, all industries. About 22% were from health systems, about 10% were third-party center managers, and then we have health providers and a few others. So we asked people what stage they were when they were responding to the survey. Most of them were what they called the sustainability, continuing to offer services. Some were expanding, some were looking to improve, some were just getting started, and some were still trying to figure out what they should be doing. A lot like what many people have done. As you probably are aware, prior to COVID, there were very few virtual services. I mean, we had the nurse and doctor call line, and those typically from an employer would get maybe 15, 20% utilization rate. During COVID, more and more people took advantage of the virtual services that were being offered by employers. because they had no other access to healthcare providers. And so it really did make a difference. And subsequently, the trust and confidentiality concerns were really kind of overcome. And so while prior to COVID, virtual services were not considered a core service of a on-site or near-site center, since that time, it is now considered a real meaningful part and an important part of a scope of services and menu offered to an employee population by an employer who has an on-site or near-site center. So again, we ask, if you offer these services, who takes advantage of them? Or I should say, who provides the services? And what we found is about 60% of the services are provided by the actual providers who work in the on-site or near-site centers. However they manage their time and take the time, they're the ones who make the calls. And I think that's really helpful because, again, people often were concerned about talking to someone or visiting them online. What would happen to their information? Who's getting it? Who's going to learn about this? Who are these people at the other end of the line? And when you have a provider who they see at the work site when they actually need to come in, also be available virtually, that trust really increases dramatically. 24% use outside and inside people. 21% use a third party. Many employers still contract with a third party for virtual services and sometimes for navigation services and other kinds of things. And so they can be tied in. And we do have some staff who work just out of the center. Some of our vendors have a dedicated unit that just does virtual services for all of their clients that are there. And about 6% who responded don't offer it at all. When we ask about utilization, we wanted to find out what percent of the total in-person and virtual service visits are used for different kinds of care. And so you could see the breakdown here. Clearly, most are offering primary care when we're using virtual services. There's a great number offering urgent care, condition management, behavioral health, which is a large part of that. But clearly, many are continuing to look at this. It's important that you measure the services that are being used, that you know what percent of people are using it, so that you can build upon that going into the future. We asked, what change do you think will be made in the next couple of years? Again, a lot of people see condition management, primary care, behavioral health, and urgent care being here. Specialty care is definitely going to be increasing during this time as well. Behavioral has become a core service. It's so difficult to get access to behavioral health providers in communities that having it available at the center, particularly virtually, is a real benefit that people appreciate. We ask them how is virtual services impacting your center, its patients and providers. We see almost 48%, over 50% say this can really help avoid emergency departments or visits. The ER is perhaps the most costly setting in healthcare. And so if you can avoid people going in for non-emergency reasons, it makes a real big difference there. Also, it helps in providing comprehensive care. Reducing medical costs is shown by a number of people, providing high satisfaction with the care, and clearly improving the remote access for people to get care. And for health providers, it seems to improve their satisfaction as well. Overall, we asked for open comments, and these are some of the comments that people had on the impact. And so one said, overall, I think, yes, it depends where it's located. We vary rural work sites. Those individuals don't seem to use telehealth as much as those closer to large system. Sometimes it could be a cultural difference. And some of our employees who work over 40 miles away, and that's important. One indicator wasn't really an increase in their workload, which many concerned providers wonder about. With the diverse hourly population and electric technology, for some populations will have problem utilizing these visits. Some people are just more comfortable seeing a face-to-face. Virtual appointments are scheduled like in-person appointments for some people, and some it's on demand. So everybody handles this a little bit differently. When we ask them, is it worth the cost? Is it worth the increase in staff's workload? Over 76% felt yes, it was worth it. And so, I think the benefit, the value equation of offering virtual services clearly is appreciated by those who answered the survey here. We ask if you considered but don't offer virtual services, why do that? And we said check all that apply. And so the largest number, 50%, said they didn't do it because there was a lack of patient interest. Now, how they determined that interest, how they described the services, what they were going to offer, it's hard to say. The next largest response was technical constraints. Either they didn't know how to do it, they didn't have the right partner, maybe the vendor partner or the provider didn't know how to do it. Maybe they couldn't get staff to support that. But it's interesting, nobody answered that confidentiality was going to be an issue or privacy was very well, excuse me. And the cost wasn't considered to be a major barrier for this. So overall, lessons learned about offering virtual services. Again, just open comments that people gave. Someone said, I think a general statement that's it's good to have, but many individuals will feel better heard when they're in the same room. Again, that personal relationship face-to-face is important. There's a segment of the patient population that puts a higher value on virtual care availability. There's also a significant number who place a high value on a personal connection. So it will depend on the population. Many times having a survey of your work group or focus groups of people to see if they would take advantage of this and what they think about it might be helpful. Post-COVID, people said it's pretty easy to implement and maintain. Patients seem to love the convenience of it. The providers like easy access it gives patients who might not otherwise come in. And that's really important for pharmacy management, helping people stay on their drugs, people who have high risk conditions to help them manage. People don't have to come in all the time, but if they have questions or they need a prescription refill, this is a way to do it. Some people said it was difficult to educate employees on what's offered and how to access. And I think that's really a situation where the providers and vendors who are delivering care need to work with the employer in formulating communications and how that should go about. And then there were those who had some confusion with the other third-party services the employer contracts with, like Teladoc or other services, and people not knowing which 800 number to call or how to connect. And that's really key. I mean, if you have an on-site near-site center, everything should filter through the center, and all the communication should mention the center. All vendors and contractors should work through the center. And having a single phone number, single website can really make a difference. Other things, people need to understand their population. What are the barriers to getting access, to getting technology? You need to have the capability to provide care in different modalities, on the phone, on an iPad, on the computer. The main focus is to reduce as many barriers as possible for people to access this kind of care and any kind of care. And you want to cover as many employees as you can. The worst thing you can do is have something just for the headquarters staff. Or one location. If you're on multiple sites, you want to be able to get people in that access in those sites. And what we find is, again, getting people in the door, offering maybe some incentive to them. Once they come in, many people find that it's easy to use, they enjoy it, and they'll use it again. Some will actually prefer virtual visits. There have been some clinical providers who are resistant to that. So it's important that they talk about the conditions. And not all providers, not all physicians and nurse practitioners and nurses, PAs are comfortable working on a virtual setting. So having some training for them can really be helpful in making their time and their information and advice helpful for people. So with that, I'm going to stop there and go around the table and see if people have questions, things they want to add. Their own advice and information. And again, I'm just going to go through it as you're shown on my screen. So when I call your name, please unmute yourself. You can unmute or show the video if you'd like. There's no requirement. But please share your thoughts with the group and any questions or other advice you have. So let's start out with Beth McIver. Beth, what's your thoughts, comments, or questions? Beth? Okay, move on. Tony Musi, comments, questions? Don?
Yeah, I'm here. Yeah,
Go ahead.
sorry, took a minute to unmute. Yeah, thank you, Larry. I've just kind of been in transit here, so I'm gonna just share with you some of the top concerns that we have with as a vendor of services. You know what our concerns are in approaching virtual care. And apologies if you've addressed these in some manner, but you know, certainly we find that there's significant interest in virtual primary care, which is, I think, the hot topic in our world. And the concerns revolve around, I think you referenced, you know, providing care across state lines. So dealing with different state regulations and making sure that licensing is appropriate. And then secondarily liability concerns around virtual primary care. And finally, you know, I think first and actually finally, last but not least, is the quality of care that's delivered and you ensure that you're providing a good service to patients. I think in some sense, you can use virtual primary care to provide service to patients that they're currently not really getting, and you can improve you know, the health, the support they have for their health by providing virtual care. But we don't want to take virtual care and replace something that's potentially better. And then how do you marry virtual care with the need for the reality that at times you're going to need person-to-person contact to provide good quality of care. So those are the top concerns, I think, on my mind.
Great, thanks for sharing. And I would say that we do have a number of vendors, third-party partners who offer these centers who have used virtual care as kind of the entry point to the center. So it's a triage approach. So people will actually go on the virtual care site, talk to a provider, and the provider will identify whether they actually need to come into the center or not. So that's helped. And the other thing Tony mentioned about the quality of care. Early on with telehealth, there was a lot of concern that providers were prescribing too many drugs without seeing the patient and knowing much. So it's important if you're going to offer virtual care and you're going to offer prescriptions that, in fact, someone's monitoring the providers, making sure prescriptions are done in an appropriate fashion. Moving along again, I'll ask Beth McIver, if you want to talk. If not, Dawn Gay. Dawn, comments or questions?
Happy New Year, Larry.
Same to you, Dawn.
Thank you. You know, it's kind of interesting. I'm working with a company that does diabetic education. It's accredited through DCIS, but we work with a lot of primary care physicians because there's a lack of time to really do ongoing education. And from an employer perspective, you really want to get a healthy employee. So the one question I have, we've not had issues from a quality perspective with what we have done nationally, but I think, you know, it's hard to connect sometimes with the employers. That's not a market that we have targeted, but I think it's a market that's needed to provide diabetic education. My question to you is that, do you find that that is a need in the worker comp occupational health market?
Well, there's no doubt that condition management, not just diabetes, but any major high risk condition, is something that people need to be managed on a frequent basis, and having access to a virtual provider makes a big difference and gives it an easy way to maintain that kind of management. So yes, I would think that's something clearly that people are interested in having.
Yeah, I will definitely get in touch with Nawak, and thanks. It's good to see you. A long time.
Same to you, Dawn. Emily Bureau, Emily, comments or questions?
Just one question. I'm curious if anyone has done any sort of surveying of their clients before really expanding virtual services. We've always offered telehealth visits. They've been really low utilization, but just curious, looking to expand if anyone's had any success or any insight into like surveying patients or clients to get buy-in ahead of time.
So please, anybody on the call is free to answer. Yeah, well, surveys are always key and important, I think. But I think if you,
I'm happy to provide feedback. We have done services very extensively, not only from the quality side, but also from a patient satisfaction. When we first started, we only had like 200 patients a month. We're over 1,000 right now. So the most important thing from a net promoter score perspective, that's something we constantly evaluate. And it's building trust. I mean, a lot of that times from the virtual, and since our certified registered dietitians and nurse practitioners work with the same patient continually to provide those services, I think that truly has helped build trust.
great, thank you very much. Gary Wall, Gary, comments or questions? Gary, unmute yourself, please. Okay. Jason Hopkins, Jason, comments or questions?
I'm enjoying kind of taking this all in. So this has already been some great feedback from the group, and interested in hearing more.
Okay. Joseph Brillatino, Joseph, Joe, any comments or questions?
Yeah, thanks, Larry. I guess in terms of state by state legality, I was looking for maybe a source people use, especially working with third-party vendors that might take on, a certain amount of volume for virtual care. Is there any specific source people use?
You're saying a source to find whether a state allows virtual care?
Yeah, and kind of across state lines as well. Like any great
I don't know,
source to
Tony,
help us.
Tony, do you have any suggestions on that?
If that resource exists, I'm not familiar with it. And that's one of the challenges in managing the whole question is, having the resources to do your own research state by state and make sure that you're in compliance everywhere.
Right. And have you guys worked with third-party vendors that do that for you?
No, it's really an individual basis.
Right.
The only thing we do know, like there's some states that don't allow pharmacists, for example, or clinics to offer pharmacy services, dispensing services, unless there's a pharmacist physically there. I think Texas is one of those, and some others. As far as crossing state lines, I don't have a list of that, but you know what? That's something I think NAWA can take on and provide to its members. So thank you for that. Come back later on, or maybe we'll post and send something out to everyone. But yeah, it's critical to know if you can do it. I've heard of some states where you have to have physically seen the provider before that provider can offer you virtual care. I have heard of that, but state by state, we'll ask the attorneys that we work with to comment on that. So thanks very much.
Thank you.
Jason Hopkins, Jason, comments or questions?
I'm actually interested as we delve into this more. We do offer telehealth services for this region, and but as employers look to partner with healthcare systems in their area, I'm interested in hearing what they're looking for, success stories, any insight that anyone might be able to share as it relates to how that partnership is maximized through virtual services. If anyone has any insight, that would be great.
Well, I think the survey gave you a pretty good idea of the areas that are most of interest. In many cases, the employer is looking to the provider or third-party vendor partner for ideas and advice. So whatever you can provide, I mean, the key ones clearly behavioral health, condition management, primary care. The more you can do in those three areas, the more attractive. And then some employers will have their own unique areas of interest beyond that. Anybody else want to comment on that?
Yeah, that's good. The survey was very helpful perspective.
Sure. Okay, thank you. Julia Tabor, Julia, comments or questions?
This has been very informative. I want to say Beth McGyver also works with me, and she's having some mic problems. That's why she can't answer. We also do nearsight and telehealth type visits, but our biggest obstacle is a lot of times in the rural areas is connectivity and the ability of the patients or the employees in the rural area to be able to connect with us. So any insight to that would be beneficial. Also, when you're doing telehealth or the telecare, how does everyone else handle the consents and paperwork like that for filing for services?
Anybody have a comment on that? How do you handle consent?
I know we've used Jot form in the past via, HIPAA compliant texting and Clara. Jot form and Clara have this kind of hybrid account. So you could send HIPAA, paperwork in a HIPAA compliant text box and they could fill it out from their phone.
Lisa Day, you use telehealth. Do you get some consent signed, or how does that work?
So typically we do most of that through the portal, through their patient registration. All that happens when they register as a patient. The consents are signed then. We do run into the rural health issue with the connectivity. So the way we've mitigated that is we have an iPad at every one of our manufacturing locations for our members to use. What happens then is the member is just given, the patient's given a link simply to access, then that initiates the telehealth call. So that way, if they do not have data connectivity, they don't have a phone, they don't have those resources, they're able to do it at work. Most of our telehealth is mental health and health coaching, not as much primary care in terms of those, just because most want to see them face to face, and there's sometimes just some more complex issues that need to be discussed. However, it's much better received than what it was prior to COVID, of course. The one thing that we do struggle with some is some of the off hours support in terms of almost like a triage line. We go back and forth how we can justify that in terms of avoiding maybe some ER usage, really just that triage. How do they really need to be seen right away? Could they wait till the next morning just to go to the health center? That sort of thing. So that's probably one of our biggest challenges. But the biggest thing we've done is really just to provide technology at each location. So if they do need to see one of our providers immediately, we have some type of electronic communication that's in their hands that we are providing to them.
Great, thanks for sharing. Anybody else want to comment on how to get rural populations involved? Now let's move on. Joe King. Joe, comments or questions?
Hi, thanks, Larry. I think just a couple of questions I had revolving occupational health with virtual services for that. I think we're getting a lot of questions from employers on the ability to offer pre-employment and annual physicals for kind of safety sensitive duty type role employees, firefighters, police, stuff like that. As far as kind of having that cohesion with it being an in-person visit, but then also the ability to have a virtual component as well for the provider medical determination clearance for that. I think just some of those kind of struggles with that and trying to determine what's appropriate from an occupational health standpoint for that medical provider's clearance, with it not being, an FMCSA type physical, but more of a safety sensitive duty physical, just what providers are comfortable with and kind of what we're able to offer both in person and virtually.
Yeah, I think it's important to include whatever you can health. There's a number of vendors offering virtual PT, virtual chiropractic as well. Many times they will provide some sensors for people to do things at home and to verify what they're doing or how they're doing exercises or how they can, what their status is. So, using technology and talking to other groups can really make a difference there. I hope that's helped. Julie
Can I chime
Trevor,
can I
please
chime
go
in
ahead.
about
Yeah.
as a provider, when I have to make a determination about safety sensitive duty, and if it's more of a surveillance type of exam, I think that if a service like that is offered, I don't know in what setting you're contemplating that, but I would say, like, let's say it's a rural fire department or something like that, that it's kind of difficult for the firefighters to get into wherever to get these services done. It could be doable, but I think there should be somebody of knowledge and of some skill still seeing the firefighter face to face and I'll use firefighter as the example since you did, but still to do a blood pressure, you have to do PFTs and other things to help you make that determination. I'm not sure if it could be truly a virtual visit from their living room and you reviewing things and that kind of stuff. I think there still has to be some knowledgeable person having an eyeball.
Yeah, definitely appreciate that. I think
I'm not sure it would be cheaper or whatever, but as a provider who has to make that determination, those would just be the things that I would be thinking of.
Yep.
Makes sense.
Thank you. Appreciate
Yeah,
that.
there's and go ahead.
I was gonna say, I think the biggest component that we were looking at with especially the NFPA physicals was the provider comfortability to, conduct virtual physical exams to NFPA standards for firefighters, being comfortable with that. If it is a truly, virtual appointment in that aspect, the other aspects, have to be in person, but for the physical exam components of it, and the provider meeting with the patient, how comfortable they are doing that virtually with those NFPA, standard recommendations with, just how in-depth that physical is.
Sure.
I think if it's a firefighter who's had an annual physical and who's relatively healthy, you could probably get away with that. And a provider would probably feel okay with kind of a virtual visit with a firefighter, maybe every other year or something, especially if they have no comorbid conditions. But I think there would have to be some guidelines put in place as to who would qualify and who wouldn't if you were going to go down that road.
Sounds good. Thank you for sharing that. We didn't talk at all much about the virtual clinics that are being offered by a number of the centers and vendors, where they have either a kiosk or they have a small room where they have almost like a medical cabin that people can go into. Many times you can have these sites set up with a monitor to see a primary care provider or behavioral health provider. And often there's either a nurse or sports trainer with that unit helping the individual patient take advantage or take the vital signs. So technology can make a difference in a variety of ways here. Let me move on. Karen Friedheim, Kate Friedheim, I'm sorry. Kate, comments or questions?
No questions at this time. Just interested in learning about all I'm hearing. Thank you.
Thank you. Caitlin Johnson. Caitlin, nice to see you again. Any comments or questions you'd like to share?
Good morning, good afternoon. Thank you, Larry. I was a little late to this, so missed the overall presentation. So I apologize if my comments aren't that relevant. Overall, we are launching an RFP to run a virtual platform across the United States that's integrated with our on-site, near-site health centers. So virtual care is top of mind for us and very, very important. Today, our on-site health centers offer video visits. Of course, it is by state, so the physicians have to be licensed in that state. And where we're seeing the majority of our visits is behavioral health and follow-up primary care. Our physical medicine, I'd say 99% of our physical medicine team, which of course is chiro, PT, acupuncture, those are all in person. And from our health plan utilization, obviously the health plans do provide telehealth, but I don't think the utilization is that high. And again, it's probably more so in the mental health space. But as I heard the points earlier about hitting more populations, particularly those in the rural area, because Cisco is now a very hybrid company where you can work anywhere, anytime, and we're not focused on mandates of returning to office. This is why we're looking at how do we provide excellent access to premier primary care to those that are not near our on-sites and near sites. So that's our initiative for this year.
Oh, that makes sense. It's a great resource to offer people. We'll have copies of the slides for you in the recording as well,
Okay.
Caitlin, so you'll be able to
Thank
see
you.
everything early on.
Thank you.
Sure. Take care.
Sure.
Lillian Shields, Lillian, or Melanie or Nick from Intermed, any comments or questions?
Hi, Larry. This is Lillian. Thank you very much for the presentation today. My question is about, well, it keeps getting pushed back, but the telehealth cliff, if you will, and what you're hearing or anyone's hearing about that. Particularly, one of our clients has a significant volume of patients who have high deductible health plans. And so it just sort of feels funny to sort of offer perhaps telehealth to some and not to others, depending on their type of insurance, and kind of toying with that idea. So I wasn't sure how folks are considering or the conversation around the telehealth cliff, should that come at some point this year.
Good question. I don't know. Does anybody have a special copay for a fair market value charge for their virtual health visits? For people who have HSAs?
Our health centers have a pretty low rate for our HSAs, like maybe, and we matched, and this was right before COVID, we matched the health plans, and it was like $20. So we're not, we're not charging $100 for a primary care visit over telehealth.
Okay. Yeah, I think you have to make those decisions, but that's a good question. That's something I'll put down in my notes. We'll get back to you on of should you charge if you have an HSA population, a fair market value. Great.
Thank you, everyone.
Sure. Stephanie Cordo. Stephanie, comments or questions?
No, I am good. Thank you for this time in this presentation. I am with Fieldale Farms. We are a chicken poultry company in a very rural area. We have 3 work sites. We do utilize virtual for primary care. We also just launched some behavioral health with something called Spring Health. And we actually do diabetes education as well. So it has been a very, very good thing for us. Our population is very diverse. We have like 26 different languages. So it has definitely been worth our time here.
Great. Stephanie, how do you handle the virtual provider when you have so many different languages? Is there a translator involved or something like that?
So we do have translation. We have our vendor is for Premise Health, and we have something called Propio. It does help a lot in that realm. Now, when you get into, I would say majority of our virtual, we're not going to be using anything other than English and Spanish. I also have bilingual providers, so that helps 100%, of course. So I guess that would be the fact that I've got the bilingual provider that can get on the telehealth is my benefit.
Great. Thank you very much for sharing that. So now, any comments or questions, Sonal?
Yes, thank you, Larry, and Happy New Year to everyone. And Larry, thanks for sharing this useful and informative survey. So I just have comments about some previous questions and also a question of myself. Speaking of online consent and offering services like occupational health, I wanted to add a perspective from cardiac rehabilitation side. Cardiac rehabilitation has been successfully being offered virtually. It involves a patient education component monitored exercises, and those I think Tracy mentioned, they require blood pressure monitor and SpO2, and also in some cases ECG monitors, and they are all given to the patients, and they're trained ones, and then they have been found to be successfully doing cardiac rehabilitation, which is a 36 session program. My question to the group is, in addition to general primary care and mental health care, etc., has anyone, especially companies like Cisco, considered preventive screening or preventive care to offer through their on-site or near-site clinics?
I think a number of people are offering preventive care in the clinics. Are you asking whether they do it through the virtual setting?
Yeah, I mean, because preventive care, I mean, you don't need to spend your staff time to have it offered inside, on site. So how many of them are offering virtually? That was my question.
Anyone want to comment if you're offering virtual primary care?
By preventative care, do you mean like health risk assessments, or the review of the health risk assessments results, or some other evaluation for prevention?
I'm thinking from cardiac perspective, but it can be applied to other kind of care as well. Yes, so risk assessment and monitoring over time for those people who are at risk.
Okay, well, that's something we can add on our future surveys to get a better handle on that.
I can kind of chime in on that a little bit and also add a question. So we just Nick, we're up in Maine. We contract with LL Bean and have an on-site clinic primarily at the LL Bean warehouse. So lots of physical labor. Most of our injuries tend to be orthopedic in nature, but we just started expanding, offering more annual health screenings, mostly biometrics. So we do cholesterol as well as diabetes screening, blood pressure screenings, and then mental health screenings. And we are going to start offering more follow-ups, not necessarily initials, because you do need to have that touch point to do those testings, but our health screening follow-ups are going to be offered virtually to go over lab results with a provider, to have more of those conversations and educational opportunities with the provider after they get their initial results back. So that's one of the ways we're going to use virtual visits here. A question I have is just where we are seeing primarily orthopedic injuries here in the clinics. Is there a good tool or resource that anybody might have from a clinical appropriateness standpoint for virtual visits in orthopedics that anybody might have to offer or share?
I know the number
Did you
of
mean the physical therapy?
Physical therapy or just orthopedics in general. So we do nurse practitioners and we have physical therapy on site here, but primarily for like the triage and evaluation standpoint, utilizing virtual visits.
I think for physical therapy, I've heard about Sword Health. They offer virtual physical therapy.
Yeah, there's a number. Hinge Health is another one. There's several of them out there that would make those services available virtually for PT or OC Health, for orthopedic management, for preventive care, ergonomics, and some other things as well. If you want to send me a note afterwards, I'd be glad to follow up with the files that I've got on those.
Awesome. Thanks, Larry.
Sure. Steve Siraki. Steve, comments or questions?
Yeah. Hi, Larry. Hi again, everyone.
Good.
Everyone's doing well. So the comment I have is our challenge that we're faced with right now is our demand was so high that we did add a second provider. We have a population of about 1,700 employees that are eligible. I think about 4,000 lives altogether, and we were staffing it initially with one physician's assistant and two medical assistants. So we had to add a second PA, and that individual only lasted a few months. So now it's been difficult for Marathon to be able to source of replacement for that individual. So again, now we have demand outstripping the available physician's assistant's time. And I don't know if it's a dynamic of pay or just the region or what it is, but that seems to be our biggest challenge that we're faced with right now.
Is that for virtual care or on-site, in person?
On site.
Yeah, do you have local systems or medical groups that you could recruit from?
Well, what I feel one of the nice things is, and Marathon does the recruiting, the school district, we're not involved with that at all. But one thing I like with Marathon is their independence from any health network, because we've studied the data and, we looked at all the unnecessary referrals that happen when there's a connection between providers and a specific health network. So I don't know if they necessarily do recruiting to poach from a network, but we certainly don't want to be connected per se to an individual network. So again, I don't really know what the answer is. I don't know if it's just a lack of PAs available in our particular region. I mean, we're suburban Philadelphia, like I mentioned in the beginning, so we have a lot of networks in the area, a lot of medical care in the area. But for whatever reason, we just had a great difficulty. Now it's becoming frustrating for our employees because one of the ways we sold our on-site healthcare center in the beginning was, ease of access, ease of care, same day appointments are available, maybe you wait 2 days, 3 days at the most. But now our employees are waiting a week or two at a time. And it's becoming frustrating for them to the point where I'm worried that's going to compromise the success we've had so far with our healthcare center.
Again, I think you don't have to be tied to a certain system or medical group to have them contract to provide a PA at the school or wherever you want to have that. And they don't have to be within your health plan network, frankly, because I assume Marathon's not billing your health plan. So the providers are working on a salary basis pretty much. So I find many hospital systems, medical groups are more than happy to go to employers, provide one of their clinicians, whether it be physician, nurse practitioner, nurse PAs, trainer MA, on a contracted basis just for those services. Maybe something to consider. Tony, you have thoughts on how you would approach this?
No, I think there's different challenges in different markets. I guess I'd be curious about, how the job description is being presented to potential applicants and whether they consider it. I think something that is more virtual in nature is going to be of interest to some, but it's going to maybe put off others because of the concerns that a job that is heavily invested in virtual care might stymie their career in some fashion. But I think there's some complex variables involved.
Yeah, I think, Steve, what we'll do is we'll have another roundtable just on staffing and staffing challenges, and hopefully be able to get you more information at that point.
Thank
All right,
you.
we've only got 5 minutes left. Let me just go around again. Tracy O'Neill. Tracy, comments or questions?
Yes, I wanted to remind everyone I'm a provider, so my views come from a provider's perspective. I'm also a medical director, so I wear both hats. I just caution as we are looking at virtual health and teledoc and things like that, like companies who are resourcing these services. One of the challenges we have currently is we have a company who utilizes us for their on-site and then utilizes a vendor for their teledoc services, so to speak. What I have found as a provider is when the patients are using these teledoc providers, unfortunately, they come to see me the next day or a week later, and what the medical decision that was made by the teledoc provider just did not make sense. And it was overprescribing and potentially causing a lot more issues in the future. So I caution that as employers are making this decision, they should really try to make a cohesive approach to make sure all these services are intertwined. If if these employees that I'm referring to had the opportunity to access through our system, some sort of teledoc portal, so to speak, perhaps overprescribing and happened on the teledoc end, because there is also no communication from them as to what they did with this patient. So all I'm getting is what the patient tells me. So they tell me they were placed on some medication, which seems like it's a big gun for a little problem, but I don't know what the clinician was thinking and why they chose what they chose. I don't want to be too judgy, because I also realize that I wasn't there, and whatever the patient said or anything like that might lead to the decision. So again, the first is just the cohesiveness of the products, making sure that everybody's working together and there's no fractured care. But then also, as we're talking about virtual care and telecare and all that stuff, yes, being available is important. And certainly the things like primary care, behavioral health, primary care follow-up, all that stuff makes sense. I know some places try to push like urgent care stuff like UTIs and other things. And I feel that those are things that definitely need to have somebody's eyeballs on them and a real look. And I do appreciate there are limitations to that with rural and things like that. But I would say it would be interesting to see not only are we providing these services, but are they quality? Because I think patients really depend, they don't understand a lot of things in healthcare. They just are happy to be seeing somebody, and they are pleased with that. But from the provider perspective, I push back saying, and I don't disagree that it's great, but are we doing quality? And that's where we may get our surveys saying, yeah, we're providing this great service and people really want it. But are we doing what we should be doing when we are seeing those patients? And again, I'm not poo-pooing the virtual health. I know it's the way of the future. I'm just asking us to think about these things when we are developing these programs.
That's excellent advice. Thank you so much for sharing.
Can I comment for a minute? This is Tim.
Yeah, please. You were the last on my list, Tim, so go ahead.
Okay. But no, I agree many things what Tracy said. So virtual care as a form of delivery of care has been going on for many years. It does not replace physician care. So the best models that work have been a hub and spoke, where you have a relationship with the provider and can reach out to different areas. So the relationship with the provider is key in almost all these areas: primary care, behavioral health, condition management. And then, so the second part of it is the provider relationship. The second part is, can that service be delivered? And we've got a variety of types of services wanting to be delivered, but then you have to decide, can they be delivered and how do they augment the care? And finally, as Tracy mentioned, continuity of care is actually the whole issue. It's the follow-up care and care management. So that whatever virtual service is tried needs to be integrated with that, and it still requires many times again, a relationship with a provider to start with, or if they come in the door for urgent care or some other condition, behavioral care as an access, then the follow-up needs to be with the provider so you can get a good foundation and continuity of care. So all of the services we've talked about, there's lots of pluses, but the negatives are, if you're going to make care management your goal, you have to integrate those, and that includes the providers and the employees. And all those other great insights you got from your survey. There were a lot of great insights, I thought.
Thank you very much, Jim. Thanks so much. Well, we're out of time here. I do want to thank everyone for participating in this roundtable. We'll follow up with giving you copies of the recording and the slides. And if you have other thoughts about this topic, please share it with me. If you want other information about NOWIC or other activities, please participate in future events and programs. And I thank you all for your time. Have a safe and happy January. Stay warm if you can. I'm here in Arizona. It's going to be 70 degrees today, guys. All right. Have a good day, everyone. Bye-bye.